I spoke to years back, had this great story. She learned through prenatal testing, I think it was just through an ordinary ultrasound, which have become so ordinary you don't even think of them as prenatal testing anymore, but they are. That's the purpose. They're not just to see if it's male or female or to have a picture for the refrigerator. It's to determine if there's anything anomalous wrong with the baby. So she had this test, and they told her the baby was probably going to be a wheelchair user. Did she want to continue the pregnancy? And she and her husband agonized, and I think she was a lawyer, he was a professor, whatever. They said, you know what, we just live the life of the mind anyway. Neither of us have ever been physically active people. We live in a ranch-type house. And you know what, we can handle this. This is no big deal. I spoke to her. The kid was 15. He had become a national wheelchair activist in basketball. They were running from one basketball game to another their whole lives because they had this athlete in a wheelchair. You can't predict where a child is going to take you.
No matter who the child is, you can't predict.
Right.
Even if you have a vision for your child, you absolutely cannot in your wildest dreams predict where your child's going to end up or what their interests are going to be.
Right. And the way that the diagnoses work is, it's a fairly sophisticated version of tea leaf reading. You can make predictions, but they're within an enormous range. Now, take Down syndrome. Sometimes if you talk to people and say, what do you fear about a child who's got Down syndrome? They talk about enormous mental retardation. What if I have a child who can never, know who I am, can't have a conversation with, which could happen. But you could also have a child who grows up to star in his own TV show or whatever. People with Down syndrome have now, graduated
and we should
from
say
college.
there is a TV star who has Down syndrome. That's why
I'm
you said
pointing that out.
Yeah.
Yeah, I've heard of this. You actually, at this point, have people with Down syndrome who've graduated from college. So you can't predict.
And we should say that the very, very major retardation is kind of the minority in Down syndrome. There's a huge range, and that's at the opposite end of the range.
Right, and that doesn't mean it doesn't happen.
Absolutely.
Okay, but what's interesting is that when you talk about this as a medical, people think medical, science, something, they think they're getting like a clear-cut thing. This is the condition.
A guarantee.
Well, a certification, I don't guarantee because it's of something so bad that they then end the pregnancy, but they think they're learning the condition of the fetus and some scientific truth, and they're not. So part of the reason that we used to think Down syndrome was so associated with very severe mental retardation is that people with Down syndrome were treated as if they were severely mentally retarded. They were institutionalized in places that would cause mental retardation in the brightest of children. So you had this kind of self-fulfilling prophecy. So even when you have, that third chromosome is clear, it's there, it's unarguably there, it causes Down syndrome, whatever Down syndrome means. It's just very hard to make a clear decision based on such an open diagnosis.
Now let me ask you this, because you're referring to a clear decision, and the clear decision you're referring to is there's a kind of an unspoken reality that when you do prenatal testing, there is the option, if there is a genetic problem, that you would abort the baby. And
terminate the pregnancy. Right,
you're
a little
right.
tricky there.
Terminate the pregnancy. And this is a very interesting phenomenon because we're talking here often about wanted pregnancies. So you're bringing in the idea of terminating.
Well, you're always talking about, that's where I get back and forth between baby and terminating a pregnancy. When you are a 14-year-old kid who finds herself 16 weeks pregnant before she had the nerve to tell anybody, you just want to get unpregnant. Those are abortions to get people unpregnant. When you've made the decision, even if it was an accidental pregnancy, not planned, wanted for 10 years or whatever, but you said, okay, we're having a baby, I'm going in for prenatal care, I'm, painting the new room, I'm knitting booties, whatever, then you are talking about a baby. So yes, those are very difficult abortions for the woman. They're the ones that are most socially acceptable. You get enormous support for if there's something wrong with the fetus. In the US, you get the highest level of social support for those abortions. Psychologically, they're the hardest ones.
And isn't that interesting?
Isn't that just?
Yeah.
Those are the ones that are really very hard for women because they require them to think as if they were the mother of this child. Is life worth living?
So how does this phenomenon change our view of pregnancy, both from the individual woman's perspective and from a social perspective?
Well, from the individual woman's perspective, the phrase I used when I named that book I did a long time ago was the tentative pregnancy. It puts a woman who's going through this in a position of, I'm pregnant, but I don't know yet if I'm going to have a baby or not. I might be having an abortion and starting over again. That's a really hard thing to hold for any length of time. You have to, you know, oh no, I won't have a drink because I'm pregnant, I'm taking care of the baby, but maybe I'm not having a baby. So it introduces this very strange limbo state. It does some very odd things to our notions of, our imaginations of what it is you can control. It gives us this fantasy notion that you can control the kind of child you have. And everything any of us who've ever raised children know is this is not about control.
Don't you think, too, that also raises a much broader question about the way Americans view medicine, that we look to medicine for guarantees? So it's part of that package, too, that we assume that medicine is going to take care of just about everything.
Right, and it can't. And it assumes that these are medical questions when they're not. I mean, one of the things that I hear often, for instance, American and European doctors who provide this service make a big distinction between the way they use it for medical indication and the way it's used in some places for what they call social indication, so sex choice. And somebody who, in, you know, a poor rural Indian community that values boys and is on her third pregnancy and has 2 girls. When she has that test, they say, oh, that's social. When a middle-class, 37-year-old couple with 2 professional careers in their own home say they don't want to have a child, say with a neural tube defect who would need a wheelchair, they say that's a medical indication. It's, look, if there's such a thing as, you know, coming back in a next life and you had your choice, you could come back as a 3rd daughter of a dirt poor Indian woman in a community that really doesn't want any more girls, or a wheelchair using son, daughter of a middle-class American couple with professional degrees in a rich community. Which one would you come back as? And then tell me this is a medical, not a social issue.
That's a really interesting way of framing the question, absolutely. Now, you've interviewed hundreds of women for your book, Tentative Pregnancy, about their decision. Should I have an amniocentesis? Should I not? How will I use the information? Or will I, you know, decide that, oh, I like this information is interesting, but I'm not going to pay that much attention to it? Do women, I mean, can you kind of generalize about the way women make the decision whether or not to test, how to use the test? Can you generalize from the interviews you've done?
Well, yes and no. I mean, on the one hand, obviously this is always very, very individual and personal, and you need to look at a woman's life, and everybody's life is different. What I do see is that women often understand a difference between decisions that are made because of the world we live in and not the condition of the baby they're bringing into that world. So you say you're doing it because of the condition of the baby, but you really know that if you weren't afraid that, you know, your marriage could end and you'd be ending up raising a disabled child on your own, if you know that you don't have the kind of health insurance that's going to provide what's needed for this kid.
Or even if you're an older parent and you're having a second child and you're worried about your first child caring for a sibling.
Right.
There are so many questions that...
So women do very deeply look at this in the context of their lives. So if you can generalize, it's that the generalization is women understand the social nature and fabric of their lives, and they make the decisions that way. So, I mean, I respect the decision that the woman makes. I think, you know, the Indian woman in that village has made the decision based on her life, and I'm not going to call her on it. If I'm going to be running around saying there are things people shouldn't be doing, she's not the one I'm going to be pointing my finger at. Who created the situation she's in? I've got some issues there. So to me, when I look at a woman who says, I can't afford a child with disabilities, I haven't got health insurance, I have a lousy job, I have to keep working, this, you know, a child with disabilities requires a lot of work. I haven't got the resources. My attention is not with her. It's what kind of a world are we creating in which we ask her to save us the money and aggravation that would require.